Okay, once again, I want to thank you for coming this late in the day, the end of the Homeschool Expo. I really appreciate you coming in to hear me. Just briefly, a little bit about myself. My name is Jan Butler. I received my bachelor's and my master's degree from Purdue University. When I graduated, I started working in a nursing home to get that first fellowship year under my belt, and that's not for me. I really like working with children. Well, then I got pregnant, so I became a stay-at-home mom for quite a few years and worked out of my home with other homeschoolers, actually. I began homeschooling my kids, and then when my kids were in elementary school, I just felt like I was having surgery, and so I put them in school for a year, and it worked out really well for them. So I bartered with the school to do speech therapy and put my kids in school for a couple of years. And then over the course of time, my daughter ended up getting a diagnosis of autism. My youngest child had a severe speech impediment when he was very little. And my oldest son was never diagnosed autistic. He just quite didn't get that diagnosis, but he's very odd and quirky as well. So I've had my own challenges as a parent, and as a professional, I was able to use my skills with my children. And in my quest to help my daughter, she was diagnosed autistic at the very beginning, like 15 years ago, at the very beginning of this wave of autism. And there really was nothing out there yet. I mean, I was like, autism? I think I heard about that in college somewhere along the line. So I started taking as many courses as I could, and in a few years I took over 100 contact hours of education in autism, and it was all to help my daughter. And then I began working. I worked for special school district for a few years, and then I worked for the Archdiocese for several years. 7 years ago, I felt like the Lord told me to start my own business, and I launched Victory Speech Therapy and Autism Consulting. I do not work only with autistic children. I specialize in autism, but about half my caseload is not on the autism spectrum. And so I do everything from simple articulation therapy. I work helping kids with their sounds. I work on language skills, helping kids to comprehend better what's spoken to them, helping them formulate their thoughts and get their thoughts out as well. I work with kids who have stuttering issues. I do not do much with voice disorders, just because I haven't had the clientele for that. And I also work with social skill issues, and I run my summer camp called Zebra Camp that specializes in teaching social skills. So I just want to briefly, I gave you a handout. I just want to briefly talk to you a little bit about the types of things a speech pathologist does, and then I'm going to open it up as a Q&A, all right? So as I mentioned, articulation is the way you pronounce your sounds. The most common sounds in error for children are the R is the biggest one. It's the hardest one to teach. It's the hardest one for them to get. S, L, and TH are also very common. Voice or reverse swallow patterns. Okay, that's an interesting one. Oftentimes, kids that are older and are not pronouncing their S sound clearly still have a reverse swallow pattern. And so when you have a baby that's nursing or drinking from a bottle, if you notice when they're sucking, their tongue sticks out and they have this tongue thrust kind of swallow pattern, okay? And that's typical for infants. And somewhere around 5 years of age, children will naturally outgrow that and develop an adult swallow pattern. An adult swallow pattern, your tongue is anchored to the roof of your mouth, the tip of your tongue, and you use the back of your tongue to swallow and propel food back. Some kids just don't naturally develop that, and because their tongue is still coming forward when they're eating and drinking, you'll often see when they're chewing that you can actually see that tongue come forward, and it affects their articulation as well. So that's a fairly easy thing to correct. It just takes some time to practice it and make it into a habit. If it's not corrected, some issues you see as they grow older, one, it's their speech. Also, because their tongue is constantly coming forward, it shifts their teeth around. And even if you put braces on them and don't correct the tongue thrust, when you take the braces off, the tongue keeps pressing, the teeth are going to shift back again. So it's important for that reason. Also, kids that have tongue thrust, you'll often see them sitting like this with their mouth open, their tongue sticking out, because all those muscles are weak and pulling forward. When they get older, they can develop, because their tongue and their jaw is constantly moving forward, they can develop TMJ syndrome as they get older and have jaw problems. So again, I mentioned voice disorders. That's children who have like a hoarse or raspy voice. And I really have not worked with that much at all, but that is something that a speech pathologist does. Fluency is stuttering, and that is something, again, that a speech therapist does. As far as language skills, again, I had mentioned expressing themselves as well as comprehension. And kind of tied into that, okay, so there's a couple different areas of language. One is syntax, which is sentence structure. So not all children speak in full, complete sentences. And even as they get older, they might speak in full sentences, but they're very simple and the same type of sentence format. So developing that is something that can be worked on. Semantics is vocabulary and building up their understanding of words. Morphology is how words are broken down and generally refers to grammar. So sometimes kids don't use plural markers or past tenses correctly. And some of that is developmental, but once they hit school age, they shouldn't be making any grammatical errors anymore. Auditory processing is how they understand things that are said to them. And are they following directions? Are they comprehending? Can they put words together to make sense of what you're saying? Sometimes if they have auditory processing problems, they have difficulty expressing their own thoughts. That word finding problem is very common with auditory processing and menopause. And again, social skills, and that's how they interact with their peers. Okay. So those are things, and on the handout, I have things that you can try at home with them. And also I have on there, when should you see a specialist? I'm not going to go into all that now because this really is a Q&A session, and I would just like to see if I can answer your questions. So who would like to start? Who has a question for me? Okay. Thank you.
I have 3 little ones that are two are 9 and 1 is 10, so not so little anymore. We adopted them. They've been living with us for now, I guess, 6 and 5 years. They came at 2 different times. So developmentally, I have to say that everything else I'm seeing is about 6 years. They've been with us for 6 years, and I keep finding this, that every year I'm like, oh wait, they're more like that age. So I look at this, the 9 and 10-year-old are boys, and they both, I've tried to do everything I can to get them to say their R's, and they just cannot do it. They're just not doing it. So since everything else is developmentally more like a 6-year-old, should I wait? Would you recommend waiting or going ahead and getting? I don't really want to go through the school district.
Right.
So because they're developmentally behind some other things too, and we're doing well, and I don't really want to. We're moving forward with everything, but this is something I've watched videos online and tried to get them to do things. I feel like they're this close, but I just can't get them.
Okay.
I can't get it, and it's getting to be a worse habit. I
Right.
like to.
Right, and that's important. So I'm going to repeat your question. You said you had 3 children that are adopted, and where are they adopted from? Okay, so they're domestic adoption. Okay, so they're not bilingual or anything like that. Okay, and the 2 older ones that are age 9 and 10 are having difficulty pronouncing their R sound. Okay. Okay. So the girl who's 9 also has syntax problems. Okay, I'm repeating it for the recording. Okay, thank you. Okay, I would, even if they're developmentally at age 6, physically, they're capable of pronouncing, even at age 6, the R sound. So I would not think that it's too early to start with that. I would definitely keep working on that. R is the hardest sound to teach because it's the only sound that your tongue is not making contact in your mouth anywhere. All the other ones you can say, put your tongue here, and they do. And it's like, great. Okay, the R, it's just kind of wadded up in a ball in the back of your mouth. So it's really hard to get them to do that. I usually kind of use my finger and kind of show them, and use my tongue with the mirror and start with an L sound and kind of scrape or rub your tongue across the roof of your mouth, like you're scraping peanut butter off the roof of your mouth, and pull it all the way back until you feel where it gets soft up there to your soft palate. And that's where you should say the R sound. So, it kind of gets at, it's going to be kind of garbled at first, but it's getting that in that position until they can get a clear R.
Both of them have their lips come forward. I've videotaped them. I've shown them. I've done everything I can to help them to try to see that they're making
Right.
with their lips forward.
Uh-huh.
And make them try to pull their lips back.
Try and smile and do it. Yeah. Do you do it in front of a mirror? Okay. So they're curling their lips too and doing it in front of a mirror. So at that point, if you've tried everything, it might be time to see a speech therapist and see what kind of tricks we have up our sleeve that might work.
And so for that, what kind of thing would you do? Like a once a week kind of thing?
I generally do, I start with an evaluation, and then I do typically once a week for 1 hour. And then I like to send home a home program, because the more they work on it outside of my hour, the quicker it develops.
Right. Okay. And the syntax, what about
Yes.
that? I keep thinking the more I read to her and the more she was with our family and we talk
Yes.
to her,
Yes.
that it would fix. But she can correct it if I make her stop. That she still is not doing it naturally at all. Everything's messed up. Still, not everything, but she's getting better. But it's
Right. I would add that into your curriculum and just spend time. And you can even look at pictures and say a sentence about the picture and just make sure it's grammatical. I like to use little colored stones because that's kind of tactile and visual, and one stone for each word. And so if it's a picture of a boy swimming, the boy is swimming in the pool. And then they have to touch it and say each word. And and then just get, a bunch of photographs and just practice that, saying sentences for it.
so really you feel like probably she's 9.
She definitely should be.
It should start.
Yes.
At what point in time should I say she should go see somebody about it? I don't know.
If I would say at the beginning of next school year, if she has not improved, you definitely want to get her in. Because the longer she goes, the harder it will be to fix that. Okay? Yes.
For a speech pathologist working in a school system versus a place like you have, what are some of the differences of either what they can and can't do? Why someone would choose not, besides the financial, would choose not to go through the school system versus a private?
Okay. By law, the public schools have to give services for any child that needs it. All right. So as homeschoolers, you are entitled to those services. Every school. I'm sorry. Yes. Thank you. The question was the difference between going to a public school speech pathologist or somebody like myself who's in private practice. My experience with the public schools is that they are very busy, and they have the after-school program, and they have a very small staff. And so they try and fit as many kids in to a group as possible. So your child that's working on R's might be in a group with a child who's doing social skills and a child working on math all at the same time, and trying to get all that going. And so the teacher or the speech pathologist could be very divided in their attention. Now there's the exception to the rule. I've heard positive experiences with it as well. They will generally get 15 minutes to 30 minutes once a week. I offer an hour session once a week. And, it's just kind of what you choose to do. My experience has been the public schools don't like homeschoolers very much. And so they will always be scrutinizing your choice in that. They might be looking to see what other issues is your child learning. Are you really homeschooling them? They try to suck you into the system and get you into the public schools. And so it's a really touchy situation. And I know a lot of homeschoolers would rather not go that route just because of those reasons. On the flip side, I charge money. And the public schools are free. So that's a huge difference there. When I work with your child, I'm totally dedicated to your child for a full hour. I'm not working with any other kid, so I'm giving them my full attention.
Could they also possibility kind of scrutinize of like, oh, is he really going to be socialized, and almost want him to be, well, we have this social skills group, and besides the speech therapy, we want him to also be in that, so we're making sure he's kind of getting the social skills that you're probably not providing, as a homeschooler.
Right. Because all homeschool children have social skill issues because they're just not socialized. That's one thing that I have to deal with. I advocate for you guys all the time. Virtually every homeschooler I know, that is not the issue with their child. Did I answer your question? Okay. Yeah, I mean, all in all, we basically are doing the same thing. I work individually. I don't have to put your child in a group. And the public schools, they have so much red tape. The other thing is like the diagnostics. If your child is struggling, I'm going to help them. When the public school tests your child, they have to meet certain criteria. They have to have numbers. There has to be a gap between their IQ score and what they're able to do. There has to be the normative data, like for the speech sounds, they have to be 2 years beyond, the developmental age before they'll start working on articulation. And because I'm not funded by the public schools, if your child's struggling, I want to help them. Okay? So I don't need a diagnosis. I don't need that gap. I do test, and I do come up with scores, but I'm not bound to that. So the kids that would fall through the gap, often I can get them and help them. Okay. Another question? Yes.
I have 3 kids, and 2 of them are boys, one's a girl. Both the boys have had some delayed speech. My oldest one, first child, he was delayed the most, but he uses big words, can read everything, but still has trouble with his R, and sometimes his S's too. I mean, one of the things when he's reciting memory verses or whatever, I'll say, keep your S's back, and he can do it when he's thinking about it, he'll keep those S's back, but other times he'll have his tongue up, But with the R's, he's still, struggling. A lot of the stuff that he's gone through, he's grown out of, but, he's 6 and a half now, and I don't want to let it, go too long. I just don't know how long. And like if he's reading an R, I mean, he is computing to try to make that sound. But I'm noticing like with spelling, like the other day he was writing something about somebody ran and he wrote wan, the way he says it, instead of
that's
the way
common.
it's spelled. So I just, I'm worried about that with him.
Yes.
And then my 3-year-old off and on is having some stuttering, and I've looked up like the whole developmental thing, and it seems normal. He'll do it, and then he'll stop.
Yes.
And he can't process the thoughts as fast as his brother and sister.
Right.
A lot of times he'll say, let me talk,
Uh-huh.
and he'll get his thought out, but, just kind of trying to watch those issues for both of them.
Right. Okay. So let's start with the youngest one is 3.5 and is stuttering, which is yes, occasionally stuttering. Okay, so that's typical at that age for kids to stutter. As you said, they're learning language faster than their mouths can move. And so, especially if there's other siblings and they're trying to make themselves heard and everyone's talking for them or over them, they start stuttering. And typically that goes away on its own. It can be anywhere from a month to a year. If he's 4.5, and still stuttering, then you might want to talk to a speech pathologist. If you start seeing frustration, not frustration that he won't let me talk, but frustration that he can't get that word out, that's something to be aware of. If you see secondary characteristics, which would be like trying to get that word out, he might like blink or twitch or stomp his foot and then the word comes out. Those are often signs of true stuttering as opposed to developmental. So those are just like some red flags. So just watch him and, kind of help him out. Come on, guys, give him a chance to talk and make sure you're listening to him. Take a deep breath. Okay, let's try it again, giving him that time. And that should work.
So if he's able to get it out when you say all that to him, is that a good sign then?
Yes.
Not,
Yes.
Because sometimes he does that, and is like trying to make himself focus and he gets it out and keeps talking. It comes and goes. Like he'll have a period
Yeah.
of stuttering a lot for a couple of days and I don't see it for weeks. And then all of a sudden he starts doing it again and, it's just real intermittent.
Right. And that's real common with the developmental stuttering. So just kind of keep an eye on it and see how it goes. And if you start seeing it struggle more, then you definitely want to give me a call or call a speech therapist. And as far as your other son, you said he was 6.5 and he was still having problems with S and R. And he can do the R when he's thinking about it. No, the S he can do when he's thinking.
Yeah, the R
Okay.
occasionally, we try to practice and even doing some of the things you talked about.
Uh-huh.
But he just really seems to struggle with that. His other things I thought he was never going to get over, and then all of a sudden one day he does. So I just don't know
Yes.
how long to wait it out.
Okay. Like you said, the longer you wait, the more it becomes a habit. I would try putting it into your curriculum. Like when you're doing reading, okay, let's spend 5 minutes practicing S and R, and let's just do it by itself, or let's do it 10 times. Then try doing it with a vowel, ray, re, ri, ro, ru, and then try putting it at the beginning of words. If he can get it. If he can't get it, you don't want to go that far. Those are hierarchies, okay? Same thing with the S. Let's try saying this in a word. And if he can say the S, well, you said he's doing S okay.
He can do it if he's thinking about it. When he's not thinking about it, then he'll go back to the okay.
So it's still habitual to do it the old way. So you need to just keep drilling that. And if he's able to do it in speech, then you'd want to do it in sentences or try reading. Is he reading? Okay. If you get one of his books and take a highlighter and highlight all the S's or S sound, because sometimes it's a C or a Z, S and Z are pronounced the same way. Take a highlighter and highlight them all, and then have him read and have that call his attention to it. Then eventually you can fade out the highlighter and have him just, okay, now when we're reading this page, I want you to concentrate on your S's. Okay, and if you just put that into your curriculum, try it for the rest of the school year. And if it doesn't click, then give me a call and see how that goes. All right? Any other questions? Nobody? Okay. Yes. Okay. Okay, I can talk about that off camera. Yes.
I guess what are some signs, I don't know, dyslexia or just where kids have a tendency you think they're reading, and this is not my son, but just that thing of you think they're reading, but really all they're doing is just the pictures, and they really don't want to look at the text. How do you just kind
Yes. Well, first one is they have to be reading out loud. Okay, so don't trust silent reading. If you have any any question about, oh, I'm sorry, the question was about dyslexia and kids wanting to just look at the pictures instead of actually reading the text. So one thing that is also very helpful is having one of those sentence strips, those transparent sentence strips, helping them to just read one line at a time. And I know that the booth next to me out there, Joan Brennan, with Brennan Innovation, she has a great little system for that. So if they're having dyslexia or any kind of problems following lines, that's very helpful. But making them read out loud is the best way, because then you know they're actually reading it, and stopping them every couple of sentences and checking for comprehension. Always make sure that they're comprehending what's going on. Yep. So ask your WH questions, and you can even get a blank dice at the store and just write the WH questions on each side: who, what, where, when, why. And then after a couple of sentences, roll the dice and answer a question, a WH question on what you just read.
I guess with that, what are the ages that they should be able to do those WH questions well? Like, just when?
By school age, they should be able to answer WH questions. Yeah, definitely. And if they have problems with it, then just do one. Just only answer who questions. And who means a person. Okay, or what? You're going to tell me a thing. When? You're going to give me a time. And just practice one question at a time until they're good at it. Okay? Yes.
My 3.5-year-old that stutters, he doesn't do it so much now, but for the longest time, he would always want to look at books upside down. And books I had read to him, and he would even start, at the beginning, but it's like backwards, and he's going backwards through the story and like reading it to himself exactly how I would do, and looking at it all upside down. I was like, what are you doing? The pediatrician's like, oh, he's a boy, he'll grow out of it, don't worry about it. And, it got to the point where I would say, why are you looking at that upside down? So then he'd flip it over, and then he'd, go on his way, but...
Was he actually, the child is turning his book upside down and reading upside down. Is he actually reading it?
No.
Okay.
He's
Okay.
I'm looking at pictures upside down, recounting all of it exactly how it is, but he's doing it upside down.
Okay, but he's just remembering it from being read before, but holding it upside down. I would just turn it. Come on, let's put the book the right way. Can you tell which way this goes? And see if he can do it himself.
And he does that.
Okay.
Most of the time now he has it the right way up, but it just, maybe is this indicative of anything? But
He's probably just being silly. Now, my daughter used to read upside down on purpose because she'd be bored in school, and she would read so much higher level than the other kids, so she'd hold her book upside down and read backwards. Or she would write, when she was in high school, she would take notes with her left hand instead of her right hand. She would do it like mirror image or upside down, hold her paper upside down and write it, because she'd be so bored in school. And so, but it would be fine, she was taking the notes, so that was always very interesting. You never know what our kids are going to give you. I wanted to show you my favorite app for articulation. This you can download very easily from the App Store. All right. It is called Articulation Station. Whoops. And you probably can't see from way back there, but it's this one at the top, and it has a little bumblebee on it, just so you recognize it when you're at the App Store. And you can get the pro version of it, or you can just get the app. And I think the app might be free. I think you might have to pay like $1.99 for it or something. But when you open it up, the pro version comes with all the sounds on it. If your child is only mispronouncing R or S, then you don't need to buy the pro version, because that's pretty expensive. I think it's like $60 or $70. But if they're only pronouncing one sound, then you can buy the app for cheap, and then each sound is like $1.99 or something like that. Okay, so if you do let's say the R sound, because that's the most common one, you can practice it in words, in phrases, in sentences, and stories. So that's your hierarchy. All right, so we're going to do words. And you can do flashcards, or you can play a matching game, which is kind of like a memory game. We're going to do the flashcards. And then you can choose if you want it in the beginning of words, middle of words, end of words, or in blends. Okay? Now, when you're practicing with your child at home, putting it in the beginning of words is the easiest. All right, and actually it goes beginning, end, and middle is the hardest. All right. So I'm going to pick initial. And then it shows you these great pictures. They're like real photograph pictures, so they're really nice. And it has the word printed, so they can practice saying it. So this would be a robot. And then you have the option of recording it and playing it back so they can actually hear themselves if they say it correctly or not. And depending on the kids, some kids get too obsessed with that. And I just, if you tap it, I don't know if you could hear that, it was kind of quiet, but she will say the word, okay? And then rug, and then you just swipe it, and it just, there are like hundreds of pictures on here. And it's just a great way to practice. And then again, it gives you sentences, stories, and asks you questions about the stories. There's 2 levels of stories. So it's a great app. I really like that one a lot. The other one, if your child's having a hard time with tongue placement, this one is called Speech Tutor. If you look at it, it's got kind of a side mouth on it. But that's what the app looks like, okay? So you're going to pick the sound that you want to work on. I can't see without my glasses. Okay, so it's the side of a mouth, and it shows you the tongue placement. I'm going to turn the volume up. All right, and so when you press the button, the tongue moves and makes the sound. Maybe. Oh, there it goes. I'm going to move forward a little bit so you guys can see this better. Okay. So it shows you how to place it. Then you can also turn the face to the front, and it shows you from a different angle. Okay. And so it does all the sounds. And that's kind of a neat thing also for the kids to see. They like that. Okay. Any other questions? Yes, sir. There you go. Okay. Oh, you are good. So what he said was the first app I mentioned, the articulation station, can be gotten for free, and then the pro version was $59.99, and this one is $9.99. Okay, great. All right, I've had these for so long I can't remember, and they eventually do change prices. All right, any other questions? Yes.
Maybe what would be some area that speech pathology can help with that parents don't naturally think of? Like you think of pronunciation issues, but maybe something
Yes.
that's not as...
Okay, so things that speech pathologists do that parents are not aware of. Articulation is probably the thing people think of most. I think language, like I've had children come in for articulation, and then I realize, oh, this child's vocabulary is way low. And then I start testing them, and they have, comprehension issues and expression issues and word finding problems that the parents weren't aware of. Because you just kind of get used to talking to your kid and understanding them. I was testing one child who was 12 or 13, and he came in because he had a lateral lisp, which is pronouncing, okay, so it's coming out the sides of his mouth. So the mom came in and said, we've tried everything, we can't get it to work. So that was why he came in. When I was having him read a list of words for me, I realized that he couldn't read, and they were simple words like girl, jump, boy, seashore, beach, those kind of words that a 13-year-old should be able to boom, 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 read without thinking. He couldn't read any of them. So when I talked to the mom, she goes, "Oh, but he's a boy and he's just slow." I'm like, "No, he's 13. He should be reading, and there's something going on." So I did a phonemic awareness test with him, and he didn't even know all the sounds of the alphabet, the letters made. So I started doing phonemic awareness test therapy with him and the speech therapy. And as we were working on phonemic awareness and speech, I started realizing he doesn't know some of these pictures. And so I discovered his vocabulary was very low. And so I tested his language skills, I gave him the whole battery of language tests. And he did have difficulty with vocabulary and expressing himself. And so what should have come in to be a few months to work on one sound ended up being a couple of years of language therapy, but he excelled so quickly. And the mom was thrilled, and she had no clue any of this was going on. So I think language is a big one that parents don't always catch also. I think voice disorders is one that parents don't always catch. And that's when kids talk with like a cheerleader voice or really hoarse and raspy. And that's not a typical voice, and your child shouldn't be talking like that unless they have a cold or
Is that, I actually know a
Yes.
very well accomplished lawyer in town that talks like that.
a lawyer that talks like that.
Yeah, I mean, he literally got a full ride, what is it, when you can study at Oxford,
Uh-huh.
that full.
The law school there. Yeah.
Or something, yeah.
Oftentimes, people who talk a lot for their business have vocal abuse because they're not using their voices, and they get vocal nodules and can have permanent damage. And eventually, if that's not treated, you can lose your voice permanently. So that's not something to play around with. And if your child is hoarse for more than a few weeks or a month, then, check with a pediatrician, go to an ENT, have them look at the vocal folds and see what's going on. And if they have vocal nodules, if you catch them early, you can do speech therapy to help them dissolve and go away. It's kind of like a blister, okay? Think of a blister. If you start treating a blister right away, it goes away. But if you wait too long, it turns into a callus, and it could be there the rest of your life. And that's kind of what vocal nodules are, so they can get hardened and permanently there. And if they keep getting bigger and bigger, they can, cause permanent damage to your vocal folds. Yeah.
Is there any, and this probably, you could talk about it after the interview, but
Sure.
is there any ENTs you recommend? Or?
I have not found a good ENT in a long time. The ones that I used to refer to have retired. And so I usually just recommend asking your pediatrician for someone, or the hospitals. Children's or Cardinal Glennon usually have some pretty good doctors there. Okay. Anything else? Okay. Well, thank you very much for your time, and I appreciate you staying here so late for me. Thank you.